Hi, I'm Dr. Joe Alaimo, and I'm a board-certified chiropractor, and my practice primarily focuses on chronic metabolic conditions. Today I want to take a minute and talk to you about male menopause, also known as andropause. Typically this doesn't get as much publicity as women going through menopause because for men it comes on over a real long period of time, so the symptoms are more gradual. It's classically and clinically really described as the cranky old man syndrome. This is where women say that their husbands get big old pot bellies and they lose their libido. Some of the common symptoms with andropause include decreased libido, mental fatigue, depression, lack of motivation, and typically this is not just because they're decreased in testosterone. There are reasons that the testosterone levels are decreased. Most likely the cause of andropause is due to high carb diet, believe it or not. Because when you take in too many carbs, your body produces too much insulin. When you produce too much insulin, insulin has an ability to aromatize or change testosterone into estrogen. So when men develop, that's when they get the symptoms of testosterone deficiency. Traditional healthcare approach to this is to just give you testosterone. But if your body is taking the testosterone that you have and producing estrogen with it, which is common with insulin resistance, that's what happens. Testosterone creams and replacement therapy is just not going to be the answer. So in our office, what we do is salivary hormone testing to determine levels of luteinizing hormone, which is the hormone responsible for stimulating testosterone production in the testes. And we also check estrogen and testosterone levels, again, in the saliva. The reason we like salivary testing is because it measures the free fraction form of these hormones and gives us a real accurate picture of how much hormone is actually getting into the cell. So if you have a decreased testosterone, if you have signs of testosterone deficiency, again, some of the things we talked about, depression, loss of libido is a big one. These are things that we want to really look at the diet, and we want to get good, accurate measurements of testosterone and estrogen to make sure that you're not aromatizing or turning your testosterone into estrogen. And we also want to make sure that you're not eating too many carbs causing that. Because if that happens, that cycle has to be broken. Because if it's not broken, you can take all the replacement therapy in the world, and it's not going to fix the problem that you have, which is converting your testosterone to estrogen. Another big problem with men, whenever they come to the office complaining of decreased libido, we always look at the thyroid. Even though thyroid disease affects women 24-1 compared to men, we always want to rule it out in cases of low libido. Typically what happens is when a man has hypothyroid, we get an increase in prolactin. Prolactin is a hormone that causes lactation. So men will complain of discharge from the breast, and that's one of the first questions we'll ask somebody that comes in with loss of libido, to try to rule out a thyroid problem. Because what happens when you have increased prolactin levels, you'll get decreased luteinizing hormone. Decreased luteinizing hormone is, again, the hormone that goes to the testes to produce testosterone. Cortisol is your stress hormone, which is another mechanism that can suppress LH. So as you can see, there's different ways and different reasons that the man may not be producing enough testosterone. And simply providing replacement therapy may never restore the normal feedback loop that happens in the body. So in our office, we like to get to the underlying cause, address those, and restore normal vitality, virility, and vigor to a man. You don't have to have that grumpy old man syndrome just because you're getting older. So let's get it checked out. Give me a call and we'll see what we can do. Thanks. Have a good day.